to have Majid Jamiu right here and BKO. All right, let's move straight to our next conversation. Health, they say, is wealth. And for security-challenged states like Benue, efforts must be doubled to ensure improved access for troubled communities. For the state governor, Reverend Father Hyacinth Alia, this is the way to go. In our Journalist Hangout Weekend Special, Governor Alia has intensified upgrade of facilities and care at the Benue State University Teaching Hospital, Makurdi. The teaching hospital now gets an ultra-modern cancer center, a therapeutic center to attend to children with special needs, a VIP smart clinic, and a pharmacosurgical complex set to eliminate fake drugs and price hike. Babajide Kolade Utitoju visited the hospital to assess the facilities. Now let's share the story with you.
Benue State University Teaching Hospital is a tertiary-level health service provider, inaugurated in the year 2012 to provide excellent health care to the people of Benue State and surrounding areas. It also aims to offer an optimal environment for teaching and research. With various departments such as accident and emergency, surgery, family medicine, internal medicine, pediatrics, chemical pathology, dentistry, and laboratory services. The institution has gradually expanded, though not without challenges and unfulfilled aspirations. To make the institution a beacon of excellence and a destination for those seeking critical health interventions, both within and outside Benue State, Governor Hyacinth Alia is revitalizing it, upgrading equipment, infrastructure, and the capacity of his healthcare practitioners.
To see you.
Well done.
Yes, sir.
How is your work?
Work is fine.
Dr. Stephen Wande is the Chief Medical Director of the Benue State University Teaching Hospital. He is a gynecologist and expert in assisted reproduction. Is the mandate handed to him by Governor Alia. My meeting with Dr. Wande was to enable me understand the ongoing transformation at the hospital and its potential impact. The engagement began at the project site of the Benue State Cancer Center.
I was brought in here 17th of October 2023 when the governor came on board to completely transform the teaching hospital. We did an international investment summit within 6 months of being on board. We have another the second one. It's a yearly event. Yes. The second Benue State University Teaching Hospital International Investment Summit is coming out in October. So the first one we did was to highlight what we want to achieve within 1 year. It's good to state that the surrounding states, neighboring states don't have a cancer center. Taraba on this way doesn't have. Part of this crossroad upper part doesn't have. Kogi doesn't have. Nasarawa doesn't have a cancer center. So Benue people have to travel to Abuja, and it's just coming up. So this will be a hub to hold healthcare because a lot of patients are dying of cancer.
The project, valued at 18 billion naira, is named after Nigeria's First Lady, Senator Oluremi Tinubu. Upon completion, the center will provide comprehensive cancer care. At the time of my visit, the project was at the foundation stage. Completion is targeted for January 2026.
This project is about 18 billion, and so far the governor has released 2 billion. So we're waiting for the second tranche now. It's going to take care of both the prevention, both the surgical aspect, both the chemotherapy and the radiotherapy. So it's all in one cancer center, and it's expected to be completed by January next year.
January next year.
Yes.
You are confident that you will deliver
Yes.
by that time?
Yes.
But in terms of release of funds,
So far they have released 2 billion. The project,
and if it's going to be 18 billion, you still have a long way to go.
The construction is just 4 billion. The equipments are 14 billion. So equipment, once you pay, they are coming. So now it's just the 2 billion to complete this one. The equipments you pay, they will come.
Furnishing.
Yes, and the furnishing. The equipments, once you pay within months, they'll be here. So it's not a big deal at this point.
Okay.
In addition to the cancer center, which is gradually taking shape, the Benue State University Teaching Hospital's therapeutic center for children with special needs is providing hope and relief to parents and their children. The center, which commenced operation in May 2025, is dedicated to providing specialized support and care for children facing a variety of developmental and physical challenges, such as learning disabilities, visual impairment, hearing impairment, physical disabilities, intellectual disabilities, attention deficit disorder, and Down syndrome, among others. The CMD says this center is changing the narrative in the care of children with special needs.
The woman that is in charge of the finance.
Next is the pharmacosurgical complex, where drugs and consumables will be made available to patients at affordable prices. With direct partnerships with manufacturers and suppliers, the initiative will help combat the menace of fake drugs and out-of-stock syndrome while ensuring value for money.
That will warehouse all the hospital needs, whether lab, whether mortuary, whether eye, anything. They will network with suppliers directly from the company so that will bridge fake. Because most of the ones here you have, we don't know the source. So you are treating somebody with diabetes, don't know where the insulin is from. And then the preservation insulin, nobody has cold room. This is the pharmacist to be here, the supplies to be here, here and up. We don't want our patients to go and get drugs from sources that we don't know. Let's take responsibility. This is a full drug.
You speak directly with the
with the companies. They give us supplies. Company and manufacturer, they bring supplies direct. One, it will be cheaper. There will be no third party. It will be original. We can even cut costs because it's government. So here, government is paying tax, government is paying water, government is paying light, government is paying staff. So the cost should be lower for them.
The pharmacosurgical complex also houses a cold room, the first of its kind in Benue State's healthcare sector, to provide proper storage for pharmaceuticals.
And there is also this problem of drug inadequacy. You know, that's a problem in many of our hospitals. How have you addressed that?
You know, when I remembered Abacha's speech, when he overthrew, he said our hospitals have become mere consulting centers. Yes, so it means that the doctors just write, the people take the prescription to other places. So we don't want that kind of thing. We want to be sure.
Beyond these interventions, the administration of Governor Hassan Alia aims to reduce outbound medical tourism by establishing a 5-star VIP smart clinic.
So this is what we converted this one to. I will have to scale it.
So this
Once
is
money,
this VIP. VIP unit.
Yes, unit of the hospital. There's no card.
As a VIP patient.
Yes, they register you. Once they register you here, he hits the doctor that you are seeing. So by the time you go to the doctor, he's already waiting for you. And by the time the doctor sees, he's already waiting at the lab. By the time you get to the lab, he's already there. And by the time they prescribe, before you get to the pharmacy, they're already waiting for you. And if they need to talk to your doctor anywhere in the world, they'll use the telemedicine. If they want to get any record, electronically, they can transmit records.
So the whole idea is to give 5-star treatment.
They can run at home.
Patients.
Yeah, they can pick patients from home. They can treat you at home. They can pick you. They can drop you. You can arrange to see any specialist at any time of the day. Saturday, Sunday.
The VIP Smart Clinic is a significant step in the Benue State University Teaching Hospital's commitment to modern healthcare delivery. Within the clinic are facilities and services not typically available at regular public hospitals.
There's what we call hydrotherapy.
Hydrotherapy.
Yes. These Chinese, they do a lot of hydrotherapy. We have signed an MOU with Chinese to use this thing for treatments that they do. We created a balcony for people to, we are going to put, it's still work in progress, but the white man says that when you are facing water, and you are resting here, so they'll put a shield here, put chairs for patient relatives. So when they sit in the evening, as they are sighting, they are distracting themselves with the water. This is River Benue.
Yes.
The bridge is here, that bridge is also here.
So this like the relaxation
yes,
point.
yes. You can stay here in the morning and in the evenings. But it's still work in progress.
And
yes. We are going to put a shield here. It's work in progress.
So they can look at the river?
Yeah, they can look at the river. Can look at the river and relax.
This initiative aims to make public hospitals more appealing to high-end users.
If we can make our hospitals, public hospitals, appear like this, then why will people go out? Even the governor can come here. Equipment are here. You have, this is a microwave, this is fridge, this is wardrobe,
small wardrobe
for them to keep things. In fact, the toilet is designed in such a way, even if you are tired, you can sit down and still take your bath. Because that's why they have that. If somebody is even sick, he can sit down and take his bath.
Dr. Amos Oko, a fellow of the West African College of Surgeons and a consultant general and laparoscopic surgeon, is the coordinator of the VIP Smart Clinic.
Our vision is to be the leading VIP Smart Clinic, known for delivering exceptional, discreet, and personalized healthcare that redefines the standards of medical care and luxury. We believe that healthcare should not just be about medication. Healthcare should be about the people. Healthcare should be about dignity. It should be about peace of mind. We have also integrated a team of professionals, highly trained professionals, consultants, who understand this vision, and they are working alongside with us to ensure that we create this kind of experience to our patients. It is about a culture of professionalism, of courtesy, and excellence. So our services here are rooted in the core values of customer relationship management, where our clients feel heard, valued, and respected.
According to Dr. Oko, the VIP Smart Clinic offers telemedicine, off-peak consultations, and other specialized packages designed to reflect a culture of excellence and ensure client satisfaction.
The kind of care we are offering here is what we call like a concierge level of healthcare, where a patient feels that a doctor or nurses are personally attached to them.
With a dedicated team, the coordinator assures that the clinic will continue pushing the boundaries to make the hospital a top destination for healthcare services.
We want to escalate to a level that we'll have not just rooms. Of course, you know we have 10 private rooms here, which are luxurious, but in the future, we don't just want to have rooms. We want to have suites. We want to have, suites that will incorporate a sitting room, a kitchenette, and some other facilities.
To address water scarcity at the hospital, a 230,000 liters per day water works project is currently underway.
Using borehole
water while being close to the Benue River.
Yes. So it's now that we're embarked on the water. His project is about 90%.
Water sourced from the River Benue is subjected to treatment at a purification and tertiary lab, ensuring a steady and safe supply, eliminating the problem of water scarcity that previously hampered hospital operations.
From the main mini water works tank, the final purified water, prepared water, is pumped to this one and stored. So these are storage facilities for the final water.
Within the Benue State University Teaching Hospital, we have a water treatment plant. It's designed to solve the problem of scarcity of water that had endured for many years. So once this is completed, it's about 90% completed, held down by the sudden death of the contractor. Once it's completed, the issue of scarcity of water will be a thing of the past within the premises of the Benue State University Teaching Hospital.
As Governor Hyacinth Alia continues to emphasize his administration's commitment to prioritizing the health sector, these efforts are not only materializing but also gaining widespread commendation. The National Association of Resident Doctors, at the end of its May 2025 Ordinary General Meeting and Scientific Conference held in Uyo, Akwa Ibom State, he was recognized as the first governor in the country to fully implement the Medical Residency Training Fund at the newly approved rate, setting a benchmark for other states. With Nigerians estimated to spend at least $2 billion annually on medical trips abroad, often for services available locally. The bold infrastructural and human capital investment by the Benue State government aim to reverse this trend. Babajide Kolade Otitoju, Makurdi, Benue State.
All right, beautiful one, BKO, all the way going straight to Benue State for this report. Thank you so much. But talk to us. You were there, but what prompted the recent upgrades you know, at the Benue State University Teaching Hospital by the governor?
First and foremost, governors have more funds to work with now.
Yes, we need to.
Any governor unable to make his mark is thoroughly unfit for that position. They have more funds now coming from the distributable revenue from FAC. So all the governor needs to do is look at his state, look at what needs to be done, prioritize some projects over others, and then focus on delivering on those projects. So if you looked at the state of the health sector before this government took over, there was a pressing need to do things better. There was a pressing need to fix rundown infrastructure. There was a pressing need to address some needs of this major tertiary health institution. So the governor just felt that he needed to do something new. Okay. Like the cancer center, in that area, there is no such thing as a cancer center like this. So the governor knew that, look, if we do not build a cancer center, our people will suffer. Okay. They will need to travel long distances before they get treatment.
All right, BK, we're still going to talk about the cancer center, but we need to pay some bills. We need to go on this quick break. When we return, the conversation continues. Don't go away. We're back. It's still journalist hangout. So, BK, I need you to just quickly land on the cancer center that you were talking about.
Yes, I'm saying that neighboring states do not have such a facility. So it became such a pressing need for the state to build a cancer center. It's going to cost 18 billion, along with equipment, along with furniture, along with virtually everything. So, and it's going to be named after the wife of the president, Senator Oluremi Tinubu, who visited the state, and she has shown compassion a number of times. Yeah. So then, of course, the pediatric center, there's the pediatric center where children with special needs are taken care of. In the enlarged version of this documentary, you are going to see those children, those who have problem with speaking, those with Down syndrome, children with all kinds of needs, special needs. And they are taken care of right there.
And there's also the smart clinic.
Yes, that is the bit that impressed me the most, because I saw clearly that the way that segment, once you enter that segment, it doesn't even feel like an hospital. Oh dear. It just feels like you are entering a business center. Okay. The way even you are, the way they respond to you.
Or like a 5-star hotel.
Yes, okay, or like a 5-star, like you are entering the lobby of a 5-star hotel, you know. So the way the staff, you know, respond to you and all that is different.
That's a good word.
That's customer relations management, you know, happen on the core value of customer management, customer relations management. So it's really impressive. The beds, everything is different, and the things that they put there, and of course the swimming pool. The swimming pool attached to it. When we went there, there was no water, because I saw that they were still working on some things. By the time that place is fully functional, honestly, it will be a game changer. And absolutely. I'm impressed that it's a state like Benue that has come up with something like this.
A very good one. And this would also reduce medical tourism, don't you agree?
Yeah, but I just hope that people will not pretend that they are sick now to want to go and enjoy those facilities.
If you're paying, there's a VIP, there's a VIP smart clinic.
Honestly,
if you're paying for
it. Kudos to Reverend Father St. Alia. I've read quite a lot about him. I've visited Benue State once, probably about 4 or 5 years before he became governor. You know, when he came, he cleared their almost 30 months salary arrears owed by
the previous administration.
Autumn. Yeah, he cleared it. Despite the fact that he's been challenged by communal clashes, and I mean, he remained focused. But there's some people have been fighting him. I mean, that he's been doing things differently. You know, our people, they say instead of spending that money on hospital, they should give them to shop. Yeah, but then he's committed, and because I read the report last week where the communications team of the president and the office of the information minister paid a visit to Benue State last week, and fantastic reports, just like the kind of things BKO has shown us. I mean, it's a confirmation of the fact that the man is not playing. He's not actually working. And to commit 18 billion into such a
So you can see this is the VIP wing.
Yeah.
That looks like, okay, you just entered an hotel,
yes, it's like,
and you are telling them to give you information about their rooms and all that. You can see them.
So it's
you don't see this kind of thing in hospitals.
It's
cool. It's very scary when you get in
not
there.
even scary. I mean, some of the you will see nurses in a conventional hospital. You will see nurses or those tech staff, medical technology staff. Medical science tech staff, they are the ones at the
reception.
The reception. I mean, even by merely looking at them, you are afraid.
It's always scary.
They look unfriendly.
Exactly. Always very scary.
So I think it's a good. It's a very good
you are
development.
welcome with a smile.
Yeah.
I mean, and they are not even wearing. Like, you can see they are not wearing those
exactly
those hospital. So that first gives you comfort.
Yes.
I think when next you are going to Benue, and
they said you can get personalized treatment and off-peak treatment and all that. In a way that makes you look special.
Absolutely.
Yes. I've heard about the unique hospitality of the Benue people.
All right,
I think they are taking this into the...
Some people are even abusing it. That was why that girl lied shamelessly that in Benue, people offer their wives as gifts. And I had to come out that, look, this is a lie from the pit of hell. I've been there a number of times. It doesn't happen.
Absolutely.
And as much as the Benue people like me so much,
nobody ever
offered me their wife.
But anyway,
so it's a lie. People should stop.
Exactly.
Thank God that person has apologized.
Absolutely.
I want to go there to find out.
All right, gentlemen.
I want to do
Thank you so much, Maji. Thank you so much for doing this. BKO, as always, thank you so much for doing this report. Thank you so much. And that's it on Journalist Hangout today. Join us tomorrow for another episode of the program. You can watch the repeat broadcast of this episode tonight at 11. Join us on Sunday from 1:30 to 3:30 p.m. for Journalist Hangout on Sunday. We are on YouTube at youtube.com/TVC News Nigeria. I am Benga Oreshegun. Bye for now, and God bless Nigeria.